Hi, I'm sorry I can't be there tonight in person. I'm in Seoul, South Korea at a conference. I just want to welcome you all and thank you for your support for Ian's Friends Foundation. I'm happy to have this opportunity to tell you a little bit about what we do in our lab. All of us, have been struck by a story with cancer, and we know loved ones or friends or others that we care about be affected with cancer, and also in public life with what's happened with Ted Kennedy recently. And the question always is, hopefully it won't happen to anybody that's close to us, but unfortunately the way it is, cancer is indiscriminate in who affects and what age and such. And it is really, something that, all that we can do is what can we do about it, and we really don't have too much control on who it affects and how. And in our lab, we are very interested in coming up with new therapies for cancer diagnosis and therapy. Typically now, if you go to a doctor, the doctor, we have amazing physicians and surgeons and cancer oncologists at Children's Hospital and at Emory and all over the country. And what the doctor does is they try to take pictures of the cancer, reach into a bag of therapies that they have, mix and match them, and come up with the best regimen that they have accessible to them to treat the therapy. Unfortunately, however, too many children and adults with breast cancer or brain cancer or prostate cancer still succumb to the disease, and that's because the bag of recipes that each doctor has is finite, and there are only so many things they can do. And what people like me and other researchers do is try to come up with new recipes, if you will, that will extend the possibilities that the doctor has to treat cancers. Specifically in my lab, we're interested in using nanotechnology to address the problem of expanding the range of things that the doctor has. For example, today, if you have breast cancer, you stage the cancer, if you can resect it, you resect it, and then you do chemotherapy. And the way we do chemotherapy is really not what I call personalized, in the sense that based on your weight and the size of the tumor, the doctor comes up with some dosage, gives the dosage for 4 months or 6 months, and then takes another picture and sees, okay, has the cancer changed, has it grown, has it regressed? We have no way of knowing ahead of time if this cancer will respond to this drug or not. And what we're trying to do in our lab is to see if we can develop technology that actually lets you predict which cancers will respond to therapy and which ones won't. And specifically with breast cancer, we've demonstrated in 3 or 4 papers we wrote over the last 2 years, suggesting for the first time that we can actually figure out which cancers are likely to grow aggressively, which ones will grow slowly, which ones will respond to chemotherapy and which ones won't, so that if we find a tumor that won't respond, you don't have to subject that patient to chemotherapy and all of the side effects, and you could try other options. So for the first time, I think we're beginning to develop things that are truly personal. Now, with respect to brain cancer, I still remember the day when Barun Brahma, who's a really talented neurosurgeon from Children's, came to our lab and said, Ravi, we have these tumors in the brain, and we can take these out, or at least the operable ones, but the real challenge is to figure out where the real tumor is ending and where the normal tissue is beginning. And it's a real challenge to figure out, to take out all of the tumors so you don't leave anything behind, and yet not take out normal tissue. So in the case of the breast or some other organ, you can be aggressive and take out excess things. It has some loss and such, but it's really significant in the brain if you take out too much tissue. Because when you take out too much tissue in the brain, some of the surgeons say it's really valuable real estate, in the sense that you could lose speech, or you could lose balance, or you could lose something else if you take out too much tissue. So you're really struggling with being precise about what you want to take out and what you want to leave behind. So the only way we have today to really determine this is to do what we call intraoperative MRI. So there are only 4 centers in the United States that have these MRI machines that they take images in the operating room, and fortunately Children's at Atlanta has one of these, where you can take an image, then go and take some more, take another image, and go and take some more, and see that you get this right. But it's very involved. each MRI scan takes 30 minutes, the child is on the operating table, and it's not widely spread, and it's not clear it works really well. So what Barun said, who's the neurosurgeon at Children's, came by and said, Ravi, is there some way we can turn the tumors blue or green or red so that we can take these out and be confident that we're only taking out the tumor? And so we thought about this and came up with a way, and this is a project we're working on now in the lab, of trying to turn the tumors blue so that not just the fortunate children in Atlanta who have access to an intraoperative MRI, but the child in Asia or Africa or South America or England or any other place can, any neurosurgeon who's talented and cares about their patients can look at the tumor, see what parts are blue, take out the tumor with the confidence that they're getting all of it out and sparing the rest of the brain. And so if we can pull this off, it would be really beneficial, not just to children here in Atlanta and in the US, but everywhere in the world, because you can see the tumor being blue without multi-million-dollar MRI machines and such being present. So this is the project we're working on with Ian's Friends Foundation's support, and we have a talented team of research scientists, PhD students, neurosurgeons working to develop this thing. Now, my lab's been fortunate in the sense that we've had funding from the National Cancer Institute, from the National Science Foundation to work on these tumor projects. And we really appreciate this funding from our federal agencies, which is actually your money because it comes through taxpayers. However, there's a real gap in funding really innovative, out-of-the-box ideas because of the peer review process and such, which is sound, but generally the funding for those things picks up when the risk of success or failure is mitigated excessively. Unfortunately, this process takes, if you think of an idea in a lab, brainstorming with a surgeon or with a student, by the time that project is typically funded by a federal agency, it takes 2 to 3 years. And when you look at children and what's happening, and Phil articulates this really well, we do not have that kind of time sometimes. And every day today, as we speak, there's a child in a hospital room waiting for some kind of attention. So where Ian's Friends Foundation really makes a difference is, in being able to support out-of-the-box innovative things that we can get started working on right away and see if we can make progress immediately right now. And we fully anticipate that this project and others in the lab will be picked up by federal agencies, will be commercialized in perhaps 3 to 5 years, but this funding from the Ian's Friends Foundation that you support is really critical to enable this. So again, I want to thank you for this evening and the time you're spending here. And Phil and Cheryl through the foundation have really turned a difficult situation through their empathy and vision into something that affects more children than Ian. And it's truly remarkable that they do this. And I can tell you that all of us are in a chain as a society and as a group of people, and we are defined by what we do for work, and if we can help one child through what we do in 10 years, that'll be meaningful for us, and I appreciate what you're doing to help us along with this process. So thank you, and have a wonderful evening. I apologize again for not being able to be there in person. If any of you want to come by Georgia Tech, we have fantastic labs and students and researchers. I'd be happy to show you around, and have a wonderful evening. Thanks.